Thank you to everyone who has joined. I'm going to give everyone a few more minutes to get on. If you are phone, we invite you to please go ahead and scan this QR code in the corner of your screen. If you have not already subscribed to Community of Practice. Community of Practice is a newsletter where we have resources and articles and other information that we like to share around COVID-19 and information and resources that we hope would be valuable from the CEAL Task Force and the immunity community. Thank you, and we'll get started in just a few minutes. Okay, once again, if you are just getting on, we're going to give just another minute to allow people to join. We are inviting you to go ahead and use your phones to scan this QR code in the corner if you have not already subscribed to our Community of Practice to join the newsletter and be able to gain access to an abundance of information and resources from the immunity community and the Arizona CEAL Consortium, who is hosting this town hall today. And we'll get started in just a minute or two. Thank you. think we will go ahead and get started. Welcome, everyone. We're really excited to bring this town hall today, COVID-19 and mental health. This is a topic that the CEAL Consortium has been spending a lot of time talking about, and we are really excited to bring this panel together to discuss it with you today. I am going to go ahead and invite our panelists, our speakers, to turn their cameras on, and I'm going to do a round of introductions. First, I'll introduce myself. My name is Suganya Karuppana. I'm the Chief Medical Officer of Valle del Sol Community Health here in Phoenix. I have also been a member of the CEAL group since it started at the beginning of the pandemic, and I've been really excited about the work that the group has done. And I am excited to be moderator for today's town hall. So our first speaker is Dr. Patricia Monroe, Dr. Patricia Harrison-Monroe. She is a PhD and clinical associate professor and vice chair of the Department of Psychiatry at the University of Arizona College of Medicine, a faculty member, educator, and clinical supervisor since 2005. She has held various departmental leadership positions, including Chief of Behavioral Health, overseeing both inpatient and outpatient behavioral health services, Director of Community Outreach and Clinical Development, responsible for the development of educational initiatives to reduce stigma within underserved communities on a local and statewide basis, and Director of Early Psychosis Intervention Center, Epicenter, the first such program in Arizona, where she oversaw clinical services for individuals in the early stages of psychosis, psychotic illness, and their families. We're really excited to hear Dr. Patricia Monroe, Harrison-Monroe's comments today. The next speaker we have is Dr. Craig Sachak, PhD. He's a professor of psychology and co-chair of clinical practice and the Division of Integrated Behavioral Health at Mayo Clinic. His main research aim is to improve the treatment of anxiety and depression in primary care. Dr. Sachak and his colleagues are developing and evaluating mental health care delivery models that can help manage the overgrowing need for effective behavioral health and pharmacologic treatments in the primary care setting. We're also very much looking forward to Dr. Sachak's comments today. And our third panelist is Anna McNabb. She is a family nurse practitioner and psychiatric mental health nurse practitioner at Valle del Sol Community Health. With 17 years of experience in healthcare, Anna obtained a communications and psychology degree from the University of Arizona and a bachelor's of science in nursing from Northern Arizona University. While working in case management, risk management, and HEDIS measures as a registered nurse, she obtained her master's of science in nursing from Simmons College and certification as a family nurse practitioner in 2015. After practicing in primary care for 5 years, in 2020, she obtained her postmaster's certificate as a psychiatric mental health nurse practitioner. Her experience in delivering healthcare to bilingual families allows patients to feel at ease in discussing some of the most challenging aspects of the current pandemic. She works closely with her patients to ensure that those with comorbid conditions are receiving the services and resources they need to meet their healthy living outcomes. This is a great group of providers that are here today to help talk to us about this important topic. Next, we are going to launch into a poll because we want to gather some information about our participants. So you should see a poll come up onto your screen in just a moment. All right. So the first question, there are 3 questions, and you're going to need to use your scroll bar to be able to see all of the questions. The first is, to what extent has COVID-19 affected your mental well-being? The second is, do you have access to resources to help you cope with COVID-19 effects on mental well-being? And the third is, what effects did COVID-19 have on your mental well-being? We appreciate you taking the time to answer these questions, and we'll give just a few minutes for that information to come in. Okay, it looks like we have our results. It looks like for the first question, to what extent has COVID-19 affected your mental well-being? We have a great deal and somewhat as our biggest responses. That is not unexpected. Do you have access to resources to help you cope with COVID-19 effects on mental well-being? Well, I'm glad to see that within this population, we do have a good number of our participants who have access to resources. However, as everyone in this group knows, that is not universally true across our population. And so we want to we still find this a really important topic to discuss. And third, what effects did COVID-19 have on your mental well-being? Lots of stress, depression, anxiety, social isolation, geographical isolation, financial stress, and other. And these are the topics that we'll be addressing today. So without further ado, I'm going to open it up to our first speaker, who I believe is Dr. Monroe, but I want to say it correctly. Yes, Patricia Monroe, you are our first speaker. So I'm going to go ahead and give you the floor.
Well, thank you so much. I know it's a long name, so any variation of that is fine. So good afternoon, everybody, and thank you so much for the opportunity to join in this conversation that we're going to have, hopefully, for all of you participating. Will give you some sense of clarity about this topic. In preparation for this meeting, I actually went back and I looked at some of the talks that I gave over this last 2 years. There were many themes that clearly changed over time as the pandemic continued to grow. But in the first few months of 2020, I spoke mostly about adjusting to change and developing routines and identifying ways to reach out and stay in touch with loved ones, how to cope with fear of the many unknowns about the virus. As time went on, I started to speak more about the debilitating effects of long-term stress, coping with continued isolation, the multiple losses that many people experience, including loss of employment and loss of housing, loss of connection with those that we care about. Significantly, this was affecting children and youth who, could not see their friends and could not go to school or be on teams or even go to graduation. So many chronic as well as sometimes acute health concerns also remained unaddressed as people really were avoiding in-person healthcare. It was limited not just because the health system wasn't available, but also by our fears, right, of catching the virus just by entering an emergency room or an urgent care center. We didn't really know enough about how the transmission was happening. And of course, the multiple losses that individuals were forced to deal with, the unbearably sad knowledge that family members and friends were dying of the virus alone in restricted areas of our hospitals here in town and certainly around the country and really all around the world. So really everyone was affected in some manner as that first anniversary rolled around. I came across an interview I gave in early 2021, where I reflected what I think many people in the mental health field were anticipating, that ultimately the psychological impact of the pandemic might harm just as many, if not more people than the virus itself. One of the researchers that was often quoted even called it the most psychologically toxic disaster in anyone's lifetime. And, we have seen a really unprecedented increase in people struggling with anxiety and depression. And then came the vaccine. And I remember kind of endless hours spent on the computer trying to catch the right moment to schedule that first vaccination for members of my family, both here as well as in New York City, where I'm originally from. I thought about all the people who did not have access to computers, who were not able to spend endless hours online. And I do have to say, I felt really privileged to be able to have both time as well as access to technology. And in my private practice, I could barely keep up with all of the callers who were seeking mental health support. Most were doing that for the first time. Sometimes I reflect on, up until COVID, I thought was probably not feasible, maybe not even very effective for my private practice to provide therapy via virtually via a secure video platform. But it really became the only option very quickly, and to this day, the preferred option for many of my patients. So it's hard to get them back into the office. In 2019, there was a study by Dr. Alcaraz and her colleagues at the American Cancer Society that analyzed data for more than 500,000 adults and found that social isolation increased the risk of premature death from any cause, for any race. Additionally, kind of the perceived social isolation is linked to adverse health consequences, including depression and poor sleep quality, impaired executive function, and as well as accelerated cognitive decline. So if we start from the premise that human beings are social creatures, we know that even those among us who are maybe less comfortable in crowds need some type of social contact, some kind of social interaction. So in the early phase of this medical crisis, before people truly were aware to what degree this would change our lives, they spent significant time worrying about, personal safety, that of the loved ones. They were also hyper-focused on maybe some of their own physical symptoms. And for many people, a cough or an ache seemed potentially to be the start of a death sentence. So there's a lot of anxiety about that initially. To divert from some of that worry, I would say many people put a lot of energy towards using that time at home to become more productive. So a significant number of my patients and friends and family had big plans for going through their closets and doing home repairs and yard work and, finally getting through that stack of paper or reading a book that they never had time for. The relative quiet of their home actually was nice. And if they lived alone, it seemed bearable. But then as the days kind of turned into weeks and then into months, I saw a real decline in that initial level of energy, and the social distancing and the imposed quarantine, it really became something that people felt strongly. Not being able to go into an office, for example, or not being able to meet friends for dinner, and marking important milestones like birthdays and graduations and even funerals in a virtual environment really started to take a significant toll. Social isolation affects the body and the mind. The forced seclusion that many of us experience in many ways was unprecedented, maybe similar to people who are incarcerated or people where it's actually meant as punishment, right? Social isolation was punishment. Maybe some people who had to isolate for a period of time because of a health condition. But generally, in these situations, we know that there's an end to that period of time. What I think became so distressing for many about the pandemic is that it was and still is to a certain extent unknown. We all have a limited capacity for stress, and these continue to be really stressful times. And the stress that does not lessen, that does not become, that does not wane, it can really lead to significant disturbances. It affects us physiologically, our immune system, our metabolism. We already talked about sleep disturbances. The sense of a lack of control over our situation really can impact also our mood and our perception. And also our ability to use coping strategies that have worked for us before. Extreme stress can really affect how well we cope with everyday challenges, but it can also intensify the mental health issues that some individuals were already struggling with prior to this. So there's increased anxiety and insomnia, we already talked about, and depression, burnout, and a sense of just really not caring anymore. It can lead to traumatic distress and stress that seems to be expressed in unrelenting kind of generalized fear and hopelessness and even suicidal thoughts. But the stress of the past 2 years affects not just those who were isolated in their homes right? There are thousands of essential workers who didn't have that luxury of transitioning to working from home. They had to be out there, potentially being exposed to the virus in very real ways, whether as first responders or medical personnel or cleaning staff or, I don't know, orderlies in a hospital setting, workers in a grocery store, bus drivers, garbage truck drivers, really any number of professions that you might think of that had to be out there. And then those had to then worry about coming home and bringing the virus to their families. And then many of them, due to that worry, self-isolated. Overall, the people who were most at risk from that isolation associated with COVID-19 were really those who were already at heightened risk for social isolation. That includes many of the elderly, members of marginalized communities, those of lower income, survivors of domestic abuse, residents in rural areas. I think that was mentioned in the poll, and as well as people with severe mental illness. So many people all around us may not have had friends or family to call in the first place, right? Or maybe not the technological understanding of how to connect to these various platforms or the money to connect to the internet. And so many, including our healthcare systems, kind of take this access for granted and build treatment structures around the assumption that people can just transition to accessing service online, but that can be a real challenge for many. So if you find yourself disconnecting more from your family or loved ones, or purposely isolating, if you start having significant sleep problems or difficulty focusing on a task, or if you're frequently thinking about, and worrying about how this will all end, if you're feeling hopeless or overwhelmed, or if you are talking to your friends and family or your pastor no longer seems to be helpful, then you really do need to seek help. And also how often you feel overwhelmed is an indication that you may need to seek additional support. There are clearly lots of conventional ways, such as individual and group psychotherapy. There's a range of medications available for anxiety and depression. Other options include, 1-800 support lines where people can link you to resources, or they can be crisis calls. They can dispatch emergency response services. There are a variety of apps for those of you who prefer self-help resources, but really it's important to remember that access to appropriate and quality mental health care remains a really significant barrier, and particularly for the underserved, for poor and minority communities. Please know that there are many ways to mitigate the effects of social isolation, and there are non-prescription ways also to address anxiety and depression if that's a concern of yours. So I think I'll stop here. I don't know what my time is, but I know my panel colleagues will address some of these issues in more detail, and then we should still have ample time for more questions. So thank you.
All right, thank you very much. Those were excellent points that you discussed. As you were talking about the timeline of the pandemic, it kind of brought me back, of like reliving that series of emotions that we went through from the beginning to that 1-year anniversary to the end. And it really has been a journey of different experiences over time. So I think you really captured it well, and thank you for your comments. And we will be bringing you back for our Q&A. But we're going to go ahead and bring Dr. Sachak up for his comments next, and I will go ahead and give you the floor.
Great. Thanks, Sue. Again, just like Dr. Harrison-Monroe, I wanted to express my thanks and welcome for folks joining us. I know it's the end of the workday as well, too, but thank you very much for joining us during the town hall today. So my name is Craig Sachak. I'm a clinical psychologist, and I work in the Division of Integrated Behavioral Health. So folks that maybe aren't familiar with that term, it really is the delivery of mental health services right in primary care, family medicine, and pediatrics. So we really team with our primary care colleagues because that's usually where people first present much earlier in their course of health and illness in the primary care setting. So we, as part of that integrated behavioral health service, we're not only servicing our community colleagues who receive their care at these Mayo Clinic primary care clinics, but also our employees and their dependents as well too. So we're seeing a pretty unique population. And integrated behavioral health really is an enterprise-wide division. So we have multiple primary care clinics throughout the state of Minnesota, the great state of Arizona, Wisconsin, and Florida, and also Iowa as well too in Wisconsin. So pre-COVID, the services that we would offer would be depression care coordination for both adults and kids, individual therapy, group therapy, social service, resource connections, and medication consultation and management. So we really have that full view of services that are available for folks. Also, Dr. Harrison-Monroe provided a really nice setup for what I'm going to talk about, are just the ways that our practice changed over the course of the pandemic, and in particular, how we've leveraged 3 different forms of technology to not only help create some kind of virtual bridge to get care going, but now that we're well into the pandemic, at this juncture, and we are back to seeing folks in person again, that how these digital bridges will actually be a standard part of our practice going forward and provides patients with additional choice. So I'm going to talk a little bit about the timeline that we went through, a timeline not unfamiliar with anybody in healthcare, but as the pandemic was really starting to ramp itself up in the United States and predominantly hitting the Pacific Northwest and the East Coast, during that early time in 2020. In early March, that's where we decided to unplug our group therapy programs. We've had a very robust group therapy practice, so we anticipated this coming and shut down our group therapy programs. And it was, honestly, about a week later where all systems kind of shut down, all the programs shut down, folks were sent home. And that became, quite a challenge in terms of people that were actively seeking their care, and then people that were needing their care. What do we do at that point? So we had to actively shut down, and we quickly pivoted over to the phone. Within about another week and a half to 2 weeks after that point, so we're getting kind of more into the 3rd week of March, near the end of March, we had video technology to now start to pilot that and roll that out to the practice. Now, back in 2014, knowing that our division was growing, we were serving a lot of smaller clinics and rural areas across a wide geography, we were actually asking for video visit technology back then, but we kept kind of getting put off. So a silver lining is the pandemic really made the video visit technology available to us to disseminate out, within just a couple of weeks. So we started to get the video visits going for the individual appointments for medication management and psychotherapy, and then as the video visit volume started to increase, we started to go down on some of the phone visits. And actually, by the end of April, we, with appropriate social precautions and protective equipment, we could start to bring some folks back for individual therapy as well too, and in individual services. And again, to Dr. Harrison-Monroe's point earlier, people were at different levels of trepidation, so it definitely was a slow trickle initially. By about mid-June, we started to pilot doing our group therapy programs by video. Another part of the practice at Mayo was doing an intensive outpatient program, and they were piloting their services by video. So we were able to work with their workflows and take that on. And then by the end of, or kind of early July, end of June, we were able to start to do group therapy back in person again at a very limited amount with, limited number of folks in the room and being masked and other safe practices as well too. But we have to think about the rapid mobilization of being able to go over to video visits, but all that behind the scene infrastructure, that has to happen as well too, which is rebuilding orders, retraining our staff in terms of being able to do those orders, building up new documentation templates and other things. So there's just like a tremendous number of colleagues that worked very hard to make that happen. So now as we kind of go forward from the video visits, and this is going to be something that will just carry us forward and a great option for patients. Working out in Minnesota, I could almost guarantee at least one time per year we'd have a blizzard that would wipe out most of my clinic schedule, and that would be the time that I would spend tidying up my office. So I'm now going to have to come in on a weekend now, because with the video visits during blizzard times, we got a bridge to be able to see folks. So the second thing that we did technology-wise are developing what are called interactive skill building modules. I'll describe what those are in a second. But just think of what happened with the patient flow and how those patient needs just gradually started to increase, and just rapidly started to increase in terms of need for mental health services. So as the pandemic hit, we had our usual flow of people that were actively in treatment and those waiting to get in. But then as the stress and the uncertainty, the losses and the wear and tear of the pandemic hit, then that created additional flows of patients. So folks that maybe we'd seen previously for a course of care had been doing fine. Now maybe they're relapsing and struggling, so they're coming back in. We've maybe had folks that maybe have been in the subclinical to mild range of symptoms, but been able to do a lot of self-management. Now with all those stressors, they're struggling, they're looking to be able to come in and seek services. And then, just a lot of folks who maybe prior to this have never really struggled with any, mental health related difficulties. And now they're struggling and now trying to get them in. So we've got this a much larger flow of folks coming through. And yeah, that has not slowed down. If anything, that has continued to grow over time. So we really need to be thinking about population-based solutions. What are different ways that we can take a limited resource and spread it out across a population, and also try to address many barriers that we run into in seeking evidence-based care. So what we did with the interactive skill building modules, this is the basic idea here is that we partnered with Patient Education and Mayo Clinic's Learning Solutions Center to develop a series of web-based modules that have multimodal levels of learning, like education, videos, opportunities for worksheets and additional resources that we could include on a web-based format, and making them free to use. So that takes care of one barrier, and being able to use really anytime, anywhere. So we really were looking at, well, what are the most high frequency problems that we're seeing, and what are some evidence-based skills that we can put out there to help reach that population. So the initial interactive skill building modules that we developed, one was building resiliency during COVID-19. So all those good kind of health habit related things that people can do to help manage stress. We did a more sophisticated one on cognitive behavioral therapy for insomnia, which is a great evidence-based treatment for sleep problems, which are just like off the chart when throughout the course of the pandemic. And then two of the newer modules that we developed, one is managing negative thinking, so dealing with worry and rumination. Another is behavioral activation, which is an evidence-based approach for the treatment of depression, so helping to deal with that kind of withdrawal and avoidance. And we've got a number of other ones that are in the pipeline, like facing your fears, so exposure therapy, tips and tools, and then also behavioral skills to manage pain. So another very common symptom that we see. But we're really looking for those high frequency common problems that we can get that material out to folks that can be done in a completely cost-effective manner. Again, I also want to highlight an important comment that Dr. Harrison-Monroe made as well too, is that there's still a digital gap, because there's still going to be some folks because of their location, their economic circumstances, may not be able to access those materials. So the third and final way are mental health apps. So we leveraged these very early on in the pandemic, because prior to the pandemic, or last 3 or 4 years, there's been a huge boom of mental health apps that are out there. Some are good, evidence-based and based on evidence-based skills, but there's also plenty of other ones where it's pretty questionable regarding their evidence base. So really, we looked to apps that did convey more evidence-based principles. A couple of really good resources to go to. The VA, Department of Defense, has developed a number of excellent apps. One of our favorite apps over the course of the pandemic is COVID Coach. So encourage people to go check that out. And then also another place that's a good place to go vet apps is One Mind Cyber Guide. It's kind of like a clearinghouse where it reviews different mental health apps, looks at it in terms of its evidence base and privacy, confidentiality, and just like usability as well too. So those are really good resources. So we created basically app prescriptions for our providers to be able to use, and we can push out, to folks as well. We know that over the course of the pandemic, just the app uptake has just shot way up. There's some really good things that have come to the market. There's also been certain apps that usually have a pay for platform that made a lot of those resources free for first responders and healthcare workers as well too. But it's also a booming market as well too, so that it can be tricky to sort through all the apps that are out there. So that's where going to a couple of those resources like the VA and One Mind Cyber Guide are really good places to be able to go to. And then when we're working with our primary care colleagues, to be able to have a narrowed down list of what are the best of the best apps that are out there and ones that are free and easy to use. So again, that we can reduce that cost barrier. So with that, I'm going to turn it over to our next panelist colleague.
All right, thank you for that. I think that you just shared a wealth of information for everybody about resources and free apps that are available. I just wanted to let you know there's a couple of, at least one question that has come up about, are there links? I think there was one link that was already sent out to everyone, but we do have a resource guide that will be sent out, as well as the recording for today at the end of the session for everyone who had registered. Those resources that Dr. Sachak put together, as well as the team, will be shared. So if you weren't able to scribble those notes down as he was talking, rest assured they're coming to you so that you can access them after. So thank you for that. That was a wonderful wealth of information, and we will come back to you during the Q&A. But I will go ahead and pass the torch now on to Anna McNabb to go ahead and hear your comments.
Hello, everyone. Good afternoon or good evening, depending on where you're listening to us from. My name is Anna McNabb. I'm a family nurse practitioner, and I do psychiatry as well at Valle del Sol, which is a community health center in Phoenix. I will be talking today about mental health from a clinical perspective, and hopefully I could talk to you a little bit about what I've been seeing in clinic, consequences of the pandemic of COVID-19. I wanted to start out first with a definition of what is mental health. I want to talk about, so we can understand when we're talking about all these symptoms and all these, treatments and how to address these concerns that we have, that we understand when it becomes a problem. Mental health is the emotional resilience which enables us to enjoy life and to survive pain, disappointment, and sadness. It's a positive sense of well-being and includes our emotional, psychological, and social well-being. When it starts becoming a problem or a hindrance, when we can no longer cope with this, with these stressors, this is when it starts becoming a problem. And this is when we have mental illness or mental disorders. There's several causes to this. One of them being genetics. It's just, what you were born with, the genes, your ancestors passed it on. Some of it's abnormalities in the functioning of the brain circuits involving emotional processing. Another reason could be chronic stress or medical illness that's causing this mental illness. poor coping skills and problems adjusting to life stresses. And the other one that, this town hall is discussing is the isolation that we've all lived through because of the pandemic that we're experiencing and that we went through in the last couple of years. The pandemic has caused grief, which includes loss of loved ones, loss of social interactions, of day-to-day routines and activities, no longer able to participate and do what we enjoyed, what provided some sort of relief from our stressors from regular life of work interactions or problems with, family members, children, taking care of our parents. We all had some healthy coping mechanisms, right? Going to the movies, gardening, doing something that you like, hanging out with your friends. That all kind of went away when we started being socially isolated. The other part of this was the threats of loss of life. It was fear. Everyone was scared of, we didn't know what this new virus was doing to us. Are we going to lose our life if we come in contact with it? That was a real stressor for a lot of people. Another stressor that was very big was the changes in school life. So our children went from going to school in person to all of a sudden being asked to go online in school. And as parents, as guardians, how do we support these children while we were still managing our employment? Another thing is our essential workers and healthcare workers were taxed to their max. Like Dr. Harrison-Monroe spoke earlier, not everyone had the ability to work from home, right? There's essential workers and people that had to go out so that we could still function as a society. Another huge stressor for people is financial problems, loss of employment. Am I going to be able to pay my rent this month? Am I going to be able to put food on the table for my loved ones? The stress of being in this pandemic caused this social isolation, which is probably one of the biggest problems from the pandemic. That's probably a root cause of a lot of these mental illnesses that have come to play into the pandemic. So a lot of our coping skills were taken. We were no longer able to have stress relief. Our mechanisms that allowed us to get through life are taken away from us. And this in turn turned our stressors into complicated depression and anxiety, among other things. It was affecting our regular life. For example, people were having a hard time going back to work. When the society opened back up, you were allowed to go back to work a couple times a week. I've had many patients telling me, I don't want to go to work. I'm scared. I'm anxious. What is going on? Why am I feeling like this when I used to go into the office 5 times a week? That was because they were having a hard time coping from the social isolation that they had. The types of common mental disorders or illnesses that are very prevalent right now are depression, anxiety, a lot of post-traumatic stress disorder. A lot of this, the pandemic has caused PTSD for many people. Sleeping disorders, some eating disorders. We've all heard stories and we've known people that are put on weight during the pandemic. Was their way of coping. Addiction, people were self-medicating. Domestic violence increased and child abuse also increased during these last 2 years. So I wanted to talk about signs and symptoms that people experience when they're going through some mental illness. And it's things that you normally don't think about. Sometimes I have patients that are telling me, I feel tired. I have no motivation. I don't want to get out of work. I don't want to get out of bed, but I don't think I'm depressed. Or they say, I'm having these palpitations. I'm dreading going to work. I have stomach aches, or my child doesn't want to go to school because they're so anxious, but I don't know what that is. So let's talk about some signs and symptoms of these mental illness and how they may present. So ongoing sadness that is prolonged, sadness that is all day long. You just feel sad and you don't understand why. Anxiety, feeling depressed. Some people are sleeping too much. I have people that tell me I go to work and I go to bed. As soon as I hit, I open the door to my house, I come in and they go back into bed. They don't eat dinner. And then they wake up the next day, go to work and go back to bed. They're sleeping 14, 15 hours. And then I have other people telling me, I just can't stop my head. I can't sleep, or I'm sleeping and waking up 3 or 4 times throughout the day. Increased appetite. I'm eating my feelings. I'm eating my anxiety. I'm anxious, so I'm eating. I put on 20 pounds during the pandemic. That type of comments that patients make to you. Or I'm just not hungry. I lost 10 pounds, 15 pounds, 20 pounds. I'm just not interested in eating. Feeling irritable or anger. A lot of times I lose my cool. You know, my husband told me something and I just snapped on him, and that is not me. This is what feeling irritable, things that normally wouldn't cause you to snap, they might bother you, but you hold your tongue and don't say anything. This is an example of feeling irritable or just angry. You don't understand, and angry at life, and you just don't understand what's causing this anger. Feeling tearful. Some people tell me, I just saw puppies on TV and I started crying. I don't know why. Feeling sad, having a lot of tears for no reasons. Low motivation, no energy. I go to work because otherwise I can't afford what I have, but I don't find pleasure in that anymore. Have been some comments that people tell me. Or I just drag myself. I'm barely getting up. I'm not showering. I'm not taking care of myself. I'm just doing the things I need to get to do them, but it's not because I want to. I have no want or energy in doing them. Feeling hopeless, helpless, having low self-esteem, feeling inadequate, or feeling worthless, feeling excess guilt. They start worrying or fearful. Lots of times I have my mothers that are fearful. They develop these fears of, I'm going to get in a car accident when I get in the car to take my children to school. Problems with concentration. I can't concentrate. I find myself in meetings. I can't understand what's going on. I feel my mind wandering. I just can't concentrate in these meetings of what they're telling me. Socially isolating, and I get this a lot from the children, where they're coming with their parents and they're telling me, we have guests over and they don't want to come out and say hi. They're hiding in their room. We go look for them. They're in the closet. They don't want to come out. So it's kind of ironic that it's caused by social isolation, but these children are isolating even more due to this anxiety that they have. Change in sex drive is another one. Physical ailments, so psychosomatic, headaches, stomach aches without obvious causes. And I always say, if you have a new headache, a new stomach ache, you always get it cleared medically. So make sure it's not a medical problem, but when everything's been cleared, we have a lot of people that come in with these stomach aches right before going to school. Children, stomach ache, I don't want to go to school, or my stomach hurts at school. They could call their mother, come get me, or these headaches that they have. Inability to carry out daily activities or handle daily problems and stress. We're always presented with problems and stressful situations in our jobs, in our homes, with our families, with our children, and usually we cope with them. Every day there's something, you learn how to cope with it. But when it becomes overbearing, that you're no longer able to cope with it, you find yourself yelling at your kids, yelling at your partner, having problems at work. That's when it starts becoming a big problem. Another thing is self-medicating with drugs, alcohol, or food. I've seen some patients tell me, I picked up drinking a lot at nighttime when I come from home. It was something I didn't do before, but now I drink. I drank 3, 4, half a bottle of wine. Picking up things that, that's not really normal everyday drinking, or, using drugs or using things to get through the day as a coping mechanism. And then, loss of interest in usual activities or things that were important to us. If you like gardening, people don't find that, going outside and taking care of their plants is causing them any pleasure or what they like to do, hanging out with friends or going out to dinner. And lastly, recurring thoughts of death or suicide, wishing to die or attempting suicide. And not everyone has an active plan to go out, but I hear a lot of, I don't care if something happens to me tomorrow. So if people say, if I wasn't around here tomorrow, it doesn't matter to me, that's definitely something that we should be addressing and looking into. How do we take care of this? What are the treatments for this? I think the most important thing, if we can do it, is to do self-care. So exercise regularly, try to get those natural endorphins that we can produce from exercise. eating healthy foods, maintaining your weight. I tell people, try not to lose weight if you're having a hard time, just maintain your weight. Pick healthy foods that are gonna help you, feel better about yourself. Fostering and maintaining healthy relationships. Getting good quality sleep. It all starts with sleep hygiene, right? Try to avoid, reading your phone before going to bed, a couple hours before to bed. Don't turn on the news if that is a trigger for you. If, hearing about the more cases about COVID is causing you anxiety, then don't read it before you go to bed. Try to make your room dark. Try, if you hear everything in your bed, then try to get a white noise, try to a fan, something to quiet the sounds around you. Go to bed at the same time, get up at the same time every day. The other thing is following through with treatment plans. I know during the pandemic that there was a lot of missed chances for, screening people. A lot of people just quit going to the doctors. So following through, things are opening up. And as Dr. Sachak talked about, there's telemedicine now, there's things available now, trying to find ways of getting those needs met, and then seeking professional help when you need it. Professional help. So we're talking about psychotherapy, counseling, group therapy, connecting with other human beings, different types of, psychotherapies to help you with what's going on. And then pharmacological interventions, which would be medication management. And you don't always have to end up with, medication management. Sometimes getting to therapy and learning coping skills. This is very important. On learning how to overcome this. And I think I want to, before I exit today, I wanted to talk about something that can make a big difference. We need to look out for our friends and loved ones, because we're the first line of defense for those. So if your spouse, your mother, your child, your neighbor, your friend, them, you can make a difference. So I wanted to read a statistic. In 2020, only 20% of adults received any mental health treatment in the past year, which included 10% who received counseling or therapy from a professional. So friends and family can be important influences to help someone get the treatment and services they need. How do we do this? These are our lifelines, right? We got to figure out who's there to support us. Reaching out and letting them know you're available to help. Sometimes when you notice these changes in someone and you ask, hey, I noticed that this is going on, or is there something that's going on with you want to talk about? I'm here for you. I think that opens up the communication, and it opens up the ability to say, you know what? I'm not sleeping. I'm not myself. Something's going on. It opens up the communication, helping them access mental health services. So sometimes when you're, depressed with anxiety, you're down in the deep end, it's hard for you to reach out. You don't have resources. On our underserved community also, where do we go with this? So helping them access mental health services, looking up things for them, helping them with community events, or looking up on, if you have access to the internet, or simply, let's make an appointment with your primary care doctor. Let's see if we can get you started on this. Learning and sharing the facts about mental health, especially if you hear something that isn't true. There's a lot of stigma attached to mental health, especially in our underserved communities. People bring a lot of shame and guilt, and they just think that they can overcome this by themselves and that they're weak. And it's not that. I think it's surpassing the stigma that mental health has and normalizing it. I think that's very important. And then treating them with respect, just as you would anyone else. And then, refusing to define them by their diagnosis. And don't use labels such as crazy, especially in our underserved communities. I hear it all the time, they think I'm crazy, and crazy is not the appropriate language to use, because we know that mental health is part, of a mental illness. It's how our brain functions sometimes. Our coping mechanisms aren't there. So I always tell people, this is just like a physical illness. It's just your brain. And I think that puts them at ease. Thank you very much.
All right. Thank you, Anna. So we had great comments from our speakers, and we are getting really close to the end of our topic of our time, but I do want to make sure that we are addressing the questions. We do have one in the chat box. I believe Dr. Harrison-Monroe is already deep into her typing to answer, so I will let her answer that one in the chat, and we can go with the verbal answer if we need to answer it a little bit more verbally. There were also some questions that were submitted in advance, and in reviewing that, I think we've actually discussed a lot of them in our panelists' comments, but there's one that I don't think anybody touched on, so I do want to throw it out to the panelists. And you can all three put on your cameras, and this could go out to anyone who feels comfortable addressing it. Have you seen or heard anything around how employers are navigating mental health support for their employees? I don't know if we've spoken very much about our healthcare workers or just employees in general and mental health support for employees. So does anyone want to go ahead and respond to that?
Yeah, I mean, I can jump in. You know, one of the employers play an unbelievably important role in facilitating mental health access. I think, you know, early in the pandemic, the messaging that was coming from every direction is, you know, we got to be resilient. You got to make sure that you're sleeping better, eating better, exercising more, staying away, you know, from the media. And when you put it into context, it really is giving people one more thing to do at a time when they're really feeling overwhelmed and overburdened. So it's actually really, really important, you know, from a leadership standpoint or management standpoint to really mind, you know, that message. Leadership needs to, or employees really need to look at the importance of encouraging time away from work, so people actually utilizing their time off so they can pace themselves. Secondly, is to help create a culture where they reinforce and reduce barriers for people to catch up on their care that they put aside for like the last 2 years, you know, dental work and other healthcare appointments as well too. So it's really kind of managing a couple of those things are actually incredibly important. And then looking at, well, what are the benefit packages that are available to employees to be able to access mental health care as well too, whether there's lowering some of the co-pays or some of the costs, expanding the network of providers. Those are just some quick ideas.
Okay. Did anybody else want to comment? I'll go ahead to the next question. I think we probably have time for one more. I'll just go ahead just to comment. Some of the other questions were strategies for improving quality of life throughout the pandemic. Others were around how to regain confidence around interacting with people after having been isolated for so long. And I think our speakers did a great job of addressing those. Another one that I don't believe we talked about today is how can I bridge the conversation around mental health and well-being with my family? So for those that know that they have that issue, but they just don't know how to bring it up with their loved ones. I don't know if one of our panelists want to go ahead and address that.
Yeah, so talking about accessing mental health services has always been challenging. There are many people who really feel strongly that they ought to be able to manage the stressors that come up, and there's a significant taboo around saying that you can't handle things. And also there's concern around family members thinking you're going to tell family secrets if you go and talk to somebody and get mental health services. So I would say that it's important to be able to think and believe that you are actually in trouble, that you need to get help. So not to be influenced necessarily by stigma that your family might be placing on whether or not you should seek mental health. So if you feel in trouble, being able to say to them, look, I'm struggling. I've tried talking to you. I've tried talking to our pastor. I still feel uneasy. I worry about myself. Very often when family members hear that, then they may also feel at a loss and be kind of more open to turning that over to somebody else, to a professional. So I know many of my patients, and certainly in private practice, but also at the university, initially struggle with telling, and they just go and seek services. And if it feels like it's helpful, then often we talk about how do you tell your family members that you are in fact already seeking services. And often family members have noticed a difference in their loved one, so they can connect the accessing of services to improvement.
All right. Well, thank you so much. I'm sure that we could continue on this topic for another hour if we had the time, but we are at the end of our hour. So we're going to go ahead and launch a final poll. I want to thank all of our panelists for the time that they have given for this evening, and to everyone who helped put this event together. We're going to go ahead and send out those resources. Please take a moment to fill out these final polling questions so that we can learn how to continue to support our community in this work around COVID-19 and mental health. And we thank you all so much for coming. All right. Thank you all. Have a good evening. Take care.
Bye.